Hi, I'm MacKenzie Dickerman from Alston Bird's Healthcare Group with a quick update on HIPAA technology and COVID-19 vaccinations. On January 19th, OCR announced that it will use discretion not to impose penalties for HIPAA violations in connection with the use of online and web-based scheduling applications, or WBSAs, for the purposes of scheduling COVID-19 vaccination appointments. Here with me today is Angie Burnette. She's counsel in our healthcare group, and she focuses her practice on HIPAA, and she's going to provide us with some more background on this announcement. So, Angie, who does this enforcement discretion apply to?
Great question, MacKenzie. It applies to all HIPAA-covered entities, business associates, and WBSA vendors, regardless of whether they know that their technology is being used and whether they may or may not be a business associate under HIPAA. So obviously the definition of who and what is a WBSA for this announcement is important. According to OCR, a WBSA is a non-public facing online application for scheduling individual appointments for COVID-19 vaccinations on a large scale. To meet this definition, the application must allow only the intended patients and the intended healthcare providers to have access to the information. But keep in mind, this enforcement discretion does not cover online scheduling of COVID vaccines if the system directly connects to a covered entity's EHR system.
Got it. So, what types of activities are covered by the enforcement discretion?
The discretion applies only when a HIPAA-covered entity or a HIPAA-covered business associate in good faith is using a WBSA to schedule an individual COVID-19 vaccination, and only during this national public health emergency. So essentially, OCR is telling providers that they can go ahead and use this WBSA technology now. Go ahead and schedule those COVID-19 vaccinations online without having to worry that you've gotten every HIPAA requirement perfectly down pat. The enforcement discretion also encourages folks to use vendors who will sign HIPAA business associate agreements, but it also notes that not every vendor realizes that its technology is even being used. Potential HIPAA penalties still apply to the handling of PHI by HIPAA-covered entities and HIPAA business associates unless otherwise stated by OCR. And we also want to emphasize that this enforcement discretion applies when covered entities and business associates are acting in good faith, and that may not always be the case. For example, you would not be acting in good faith if you did not use reasonable security safeguards like access controls in order to prevent unauthorized persons from viewing the data. Another example of possibly not good faith is if you use a vendor that specifically states up front that they will sell individuals' personal information. In the announcement, OCR also laid out a handful of recommended but not required safeguards. And examples of these are encryption, privacy settings, and temporary storage of the information by the vendor. This announcement by HHS is effective January 19th. And thankfully, it's retroactive back to December 11th, 2020, and it remains in effect throughout this declared public health emergency.
Thanks, Angie. Fascinating and important news from OCR. And thank you for joining this Alston Bird Healthy Bite.